Thanks for joining us. This is Live with Miami's Community News, and today we're going to be talking about healthcare. And our guest today is the National Health Director of Ola Doctors here in Miami, and specifically, your office is opening in Doral, right?
Correct.
And you've spent a lifetime in the health arena,
Yes,
right?
I have actually, not just in the health arena, in the insurance industry. I would say probably in the last 6 years or so, I've been focused in the health industry. And we can honestly say that, healthcare, we're living in a crisis, not even before the pandemic. Many American families are paying more on their healthcare, Michael, than their mortgage payment.
Yes.
So Ola Doctor has, and that's our main focus, is to be able to afford affordable healthcare for all.
When we look at I remember when healthcare was $200 a month.
Right.
And I was never so happy as to get close to the Medicare age, where you go, oh my goodness, because back a few years ago, and even
Yes.
family members, $800 to $1,100 a month is not an unusual thing. And it is a crisis, not just a financial crisis, it's a family crisis that is going on.
Right.
And certainly with the pandemic, we realized how important good health is, and also to make sure that we're covered. So you've worked with A-rated insurance companies, all right? You made a choice to go with Ola Doctors. Can you tell us a little bit about Ola Doctors?
Yes, most definitely. Actually, Ola Doctor has a really interesting story. First started as a media company, translation company, and then we are also an our main company, and I work on the Olaforce side, which is on the independent brokerage channel. And so we have agents throughout the U.S. That we help, especially not only during our regular open enrollment, which is November 1st to December 15th. We now know that President Biden signed an executive order January 28th, indicating that there's now, through the rescue plan, that many Americans that missed the deadline, Michael, on December 15th, they are now eligible. So, hello, if you are listening to this call, please, you need to talk to a health agent and call us, because there are many tax credits that they could be available to receive.
So we know lots of people, when it gets to be the deadline time, it doesn't matter what it is, whether it's Christmas or Hanukkah or insurance time or the calendar, whatever it is, people at the end sort of rush into a decision.
Yes, CMS, which is the federal government, basically gives, Michael, health agents only 6 weeks to enroll for the under 65 market. So what President Biden did in January in signing that executive order, it now has extended it to August 15th. So if you are listening today, please take the time to call us. We are here to assist you. And, looking at and re-looking at. And another thing, Michael, a lot of people don't realize, even when they enrolled on December 15th, there's additional tax credits available. So they need to call health agents to see if they qualify for some additional tax credit to lower their health care premium.
And we know that in Miami-Dade County, we have a whole range of economics and socioeconomic issues. And so certainly there has to be a place for everybody to get health care. And we're an advocate for reaching people that need healthcare, that need services. My hats off to the county and to the healthcare providers in getting the COVID vaccine and the testing to all of Dade County. Now, your organization is throughout the country. You're in about how many states now?
We're close to 40 states.
That is an amazing thing to be able to do that. When you mention force, right? Olaforce, I'm thinking, I hear Air Force. But tell us about that part of the business.
Wonderful. Yes. So Olaforce, actually, the brokerage channel is what I have a passion. I've been in the insurance business since 1986, and so quite some time. And I just have the heart, and being a Latin company, we do focus with the Latin market. If you go to our website, specialoladoctor.com, you're going to see that we are educating those consumers. So if they have a chronic condition, for example, they have diabetes, high blood pressure, cholesterol, we're actually educating them on their health care. And the Olaforce agents, what they do as well is, they're encouraging their clientele to live a healthier lifestyle. So we work hand in hand with Ola Doctor, Olaforce agents on being able, not just when they sell them an actual health plan, we're here to encourage them to keep up with their preventive care and to know the healthier steps in living a longer life.
So I'm not sure when healthcare facilities and insurance companies started talking to their patients about how to live healthier.
Hmm.
So, and a lot of people are afraid that if they have diabetes or arthritis or some sort of cancer, right, that means they're going to be excluded from being able to get insurance. What is the motivation for insurance companies to speak to their clients about staying healthier? Why do you want to do that?
Well, the number one reason I would say, especially going to a preventive visit, it's going to help be able to diagnose any type of, they're on the borderline of, say, high blood pressure, diabetes, and how to control it. So that's the first step. So again, I would highly recommend. And you know what's really interesting? A lot of Americans don't realize that preventive wellness, the health wellness on their healthcare plan, Michael, is absolutely free. They don't pay a dime. So please take advantage of that. If you have a history of cancer or, diabetes or high blood pressure in your family, please, take advantage. Mammograms, your preventives every year for a woman are included in the preventive care.
We know that most men, a lot of men that are single, die earlier than if they have a partner, because the wife is constantly nagging them or reminding them to go to the doctor. And we know that's important for to live a little bit longer life. So does your agency take upon itself to reach out to people and say, by the way, it's time for your wellness check. It's time for you to go get it as a visit a doctor.
Each agent, when they sell the plan to their client, they highly recommend that. And nowadays, more and more people are starting to realize, okay, is there a waiting period? Well, the beautiful thing when they enroll in Obamacare, there's no waiting period. So once they become effective, they can go the next following month and make the call to the local doctor that accepts them within the network. And so that's a beautiful thing. The other thing on Obamacare, when it first rolled out back in 2010, is that there's no pre-existing conditions, no exclusions. I know you asked that just a few minutes ago, are concerned about that. And so again, people that enroll under the Obamacare, which is the ACA, I highly recommend that they don't shy away from, thinking that they're going to be rejected, because that's the beautiful thing about the under 65 market.
So that was the arrangement 15 years ago, that if you had a pre-existing, you essentially couldn't get covered unless you're with the company.
Right. An employer, normally they accept them all.
So folks that had something happen, I can tell you that I was one of those people. It was like, I felt like a second-class citizen.
Oh, sorry to hear that.
Yeah. And then you realize that there were millions of people, many millions of people, that had similar experiences in their soul. Like, oh my goodness, I had this problem. I don't have it anymore. But because of that, therefore, all this other stuff is going to happen. So with the Obamacare, they can go in, and the next day they can go in and get the stuff that they have been
after their effective date.
Yes, and lots of people put off things. Right?
They do.
We know that at the end of the year, if somebody signs up for Obamacare and they get accepted, is that based on the calendar year, or is it based upon the time that they sign up?
Well, for example, if somebody applies today, their effective date won't be until August 1st, because there's a cutoff date.
Yes.
Okay. So just keep that in mind. And then also, if you're listening today and you have any of these health conditions, chronic conditions that we mentioned, and misconception too, Michael, many people will think, oh, it's going to be much higher, or I'm going to be rated on it. That's a myth, because again, Obamacare, ACA, there's no pre-existing. And again, if you're listening today, they have extended the special open enrollment to the 15th of August. So definitely consider calling in.
So we look at, if you're over the age of 55 or younger, all right, high blood pressure is common, diabetes is common, arthritis is common, all right? All these factors that have sometimes scare people away from going to the doctor, right? And so they don't need to be afraid of that. But you've been in the healthcare and the health insurance business for a long time. What are some of the reasons that people do not independently go to the doctor, other than question whether they're not having insurance, even if they have insurance? Why do they hesitate?
That's a really good question, Michael. The only thing I can think of is maybe the lack of maybe finding a provider. So I would say what they truly need to do is work with their health agent to make sure that they find a good primary doctor in their area, and just be able to connect with someone local, whether it's a primary doctor, a specialist, and really just to see how easy it is. Because once they have a good healthcare company, the networks are pretty large here in Florida.
And so there are doctors that are available all the way from the Keys to everywhere where they're going to be able to find some
depending
providers.
on the carrier or the company. But I've seen that, depending, what network they're in. So if they're in a PPO network or say an HMO, it just depends on the network. But again, contact your agent. That's the key for them to assist you on finding a good local doctor in your area.
And so what's your relationship with health insurance companies, right? I mean, there are lots of insurance companies. People are familiar with them,
Yes.
right? So tell us about that.
Okay, our Olaforce agents, which are currently enrolling today, we have contracts with some of the name carriers. Like, for example, we have the Florida Blue, we have the Oscar and Better, here in the state of Florida. And that's just to name a few. And
so they can call up your offices. They can work with an agent who's going to figure out the best plan with them. They're going to have the conversation, say, here are the things that are available for you.
Most definitely, yes. And again, it's going to be based on the questions on the income in order to qualify. They can call the 844-925-4313 number.
And I think we're going to put that up on the screen over there. And by the way, Howard's back there producing the show. And we want to thank Howard, for doing that. So again, the deadline has been changed now. So they have until August
15th.
And so
for the under 65 market.
And then what happens for people over the age of 65?
Well, that's a good question. For those that turn 65, they are now eligible for Medicare. So highly recommend that they call a Medicare agent. And they can also call our number at 844-925-4313. And this fall, we will be enrolling for Medicare as well through our services.
And in where your office is located here in Doral, Florida, that South Florida is an amazing compilation of healthcare providers. I mean, we have huge hospitals, we have several medical schools, and we're really pleased that it is a big industry here in South Florida. And it's nice to see your home offices here. We're delighted, and that your home office is in Doral, which is one of the most dynamic cities, certainly in the state. And that when that happens, it certainly ranks them in one of the top cities in the country. A lot of people haven't recognized that, but we recognize it. And so we're delighted that you all are doing that. So tell us again about the employment opportunities for independent healthcare agents.
Yes, actually, like I mentioned, Michael, I am the National Sales Director for Olaforce. So I work hand in hand with Eduardo Ibarra. He's our independent manager. And what we basically do is, being in the insurance business for many years, and Eduardo as well, we have the greatest opportunity to bring on independent agents that are getting started for the first time. And so in the healthcare side of it, so we basically equip them not only with agency support, their customer support. We have a CRM system. We have a lead source that we want them to excel. So we want these independent agents. So if you're an agent looking as far as coming on board or looking for a company that is well established and is also has a heart in the Latin market, please give me a call. Or you can email me at jperez@oladoctor.net, or you can reach me at 316-833-2784.
So let's say somebody's not currently an agent, but they say, hey, I'd like that business. So you're going to train them to be successful at this.
Yes, we most definitely. We actually even have a referral program that is through Gold Coast Schools. So we know that many people, Michael, through this pandemic have either lost their jobs or they're looking for a new career. So hello, Ola, we would love to partner with you, which is our company's name. And again, we are here to support you if you're looking for a career change, and we can assist you on becoming licensed as well with Gold Coast Schools.
So Gold Coast, from what I recall years ago, at least I knew them from the real estate arena, they would teach people how to about the real estate business, teach them to be able to pass the exam.
They're licensed through the state, correct?
So All right, so they also teach us, they can go to that class, all right, and they're going to learn how to take the tests, and you're going to assist them because you want them to be successful at your
Right.
employment.
And what our Olaforce team does in our training department, Lucia, they do a fabulous job because we have, which is called weekly webinars on all of our product lines. So I can't brag enough about the support an agent will receive, Michael. It is just amazing, from Spanish to English.
So when we look about people's life changes in the last 15 months, and when people had a lot of time to think about their lives and where they are, where they're going, and how important, good health is and good jobs. And a lot of people have gone back to school, right?
Yes.
And some will be going back to their traditional work, and some will be a sort of a split opportunity. And when we look at what's changed in the education arena in 30 years, University of Phoenix, years ago, they only offered online classes, and people sort of laughed at, no, you have to go do it this traditional way. Well, we've learned that there are a lot of ways to do this. So somebody can go to their class, their Gold Coast class, they can do that online.
Correct.
Right? And then also you have classes that you teach your specific products to those people. So when they're ready, they're going to have a book, if you will, filled with the different products, and you're going to help them learn how to speak to people, how to talk to them,
Correct.
how to move them from not having insurance or having it with somebody else to look at the benefits of dealing with Ola Doctor.
That's correct. And we actually have Ola University. So Ola University is
Speaking
also,
of Phoenix University.
Yes, I heard. Yeah. So actually what's really amazing is that we guide them along the way. So with every product line, whether it's major medical, an ancillary product, a supplemental such as, say, dental, vision, cancer, hospital confinement, life insurance, we're going to guide them along the way.
All right. So I can a person that has just a TPS number, all right, enroll, and how is that constructed so that they are allowed to do that?
Yes. So actually, when Biden signed that executive order, we know that there's those, like Miami is a hub for foreigners. Would you not say, Michael?
I had noticed that in the last 50 years.
Yes. So the beautiful thing about that TPS number is if they are fleeing from a country, going through turmoil, you could say, like, let me give Venezuela as an example. They are assigned a temporary number, and they are actually eligible for to apply on the ACA.
That is amazing.
And you know what's really interesting? A lot of people don't realize that. So again, if you have a TPS number and you're listening, please take the time to call us. Again, that number is 844-925, and it's 4313. And again, we're on standby. We're here to assist you. There's no obligation. We're just going to give you the options of what you're eligible for. And so please take advantage of calling in.
It's really, your organization is really amazing to see the kind of changes and the improvements you're making in patients' lives, all right, with your clients and with their families, and opportunities for people to become successful.
Yes.
So
I would also like to state, not only if they have a TPS number, again, please take the time to call in. The number's on the screen. But if they have no Social Security number, because we know that many people, when they come here to the U.S., they're working with the immigration or on their status. We do have a product called Ola Guard. And again, it's an accidental product that it was actually built within the company, our parent company, Pan American Life, that's been around for about 100 years. They are the #1 life and health brokerage, channel in Central America, South America, and also in Europe. So they know what they're doing, okay? And they've been in the health industry side since 1970. They heard the needs of our Latino agents nationwide of when they come across their clientele that don't have a social. So again, Ola Guard is an amazing product. It's an accidental product. It has a repatriation. So if someone passes away here in the U.S. and they would like their body to be laid to rest in, say, Colombia, then they're going to have some dollars, $20,000 there available. And then it also includes telemedicine. So the telemedicine, we partnered with Teladoc, one of the #1 telemedicine companies in the nation, Michael. And for just $12.95, they can add on their whole family. So it's going to include the telemedicine for the whole family as well. Mi Dieta, which is a program if they encounter diabetes. And the #1 thing the doctor says is, oh, Mr. Jones, you need to change your lifestyle on eating or your habits. So we can guide them as well on a diet program. It's an app on their phone. It's included under the Ola Guard, and they also receive MDRX. which is also a prescription card that we partnered with Envision.
You're an amazing person, very passionate, very excited, and an amazing company. I want to thank you for being here. But before we wrap up today, there's some young person that's sitting out there. Directly, I'd like you to talk to a 16 to 20-year-old person that's wondering about their future, right? And about what's there for them. And I think you can look at that camera there, and once you can talk right to them.
Yes. Well, hello. The age range that you just mentioned, I actually started in business when I was 16 as an intern. So if you are in college looking for an intern, please give us a call. We are looking at interns at this time. So I'm glad you brought that up in our new corporate office. And we'd love to hear from you. And then also, speaking of the young adults, if you are aging off of your parents' plan at age 26, please give us a call, because you're going to qualify right now today for the special open enrollment. Again, if you are turning 26, please keep us in mind. We'd be happy to assist you again on a healthcare program that you're eligible for. And again, you can reach us at the 844-925-4313 number.
Amazing. Again, our guest today is Jackie Perez, who is the National Health Director of Ola Dr. and Olaforce. So thank you very much for being here. We welcome you to come back anytime. And thanks for doing what you do. Appreciate it.
Thank you.
Again, thanks for joining us. This is Live with Miami's Community News. Thank you very much for your time, and have a great day.